My name is Vincent Gaudiani, and we're here at the California Pacific Medical Center in one of our cardiac operating rooms. And we're just about to begin a coronary bypass operation. What I want to do before we begin, though, is try to give you some knowledge about the heart so you'll understand a bit better what you're seeing. So let's start with that, and then we'll take you around the room and show you a few of the most important pieces that go into constructing an operation like this. And then we'll show you some of the details of the operation. Now, there won't be anything on this that's any more startling, let's say, than is on Discovery Channel every night. So we hope you'll be taken by the science of it and by the teamwork rather than by any blood that you see. That's inside all of us. Now, first of all, this thing sits in your chest just about like this, and it weighs about 1 pound, and it's composed of 2 pumps, each of which in the course of a day pumps at least 1,500 gallons. So it's doing a whole lot of work. It's moving a lot of blood, 6,000 quarts a day. It squeezes about 100,000 times. So it's using a lot of energy all the time. And in order to provide enough energy so that it can do the job of squeezing blood for you, it itself needs blood supply. And the way it gets it is as follows. The right pump gets blood from your veins and brings it up into your, the blood comes up into your right heart, and your right heart squeezes it to your lungs, 5 quarts a minute or 1,500 gallons a day. Your lungs oxygenate all that blood and let it come back to the left pump. The left pump and the right pump are pumping the same amount of blood, but the left pump is pumping it under a lot higher pressure, so it has to do more work. It has to drive the blood into your aorta here and then to everywhere in your body. Your body gets the oxygenated blood, delivers it to your capillaries and tissue take the oxygen off, let the blood go back to the veins, and then the veins come up for another load of oxygen. Now, in the process of doing this, the heart has to pump blood to itself, and here's how it does it. As soon as the left pump gets blood and pumps it into the aorta, that blood is delivered down through these arteries into the heart muscle itself. These spread out over the heart muscle and deliver oxygen to its whole circumference. If you want to think about it this way, the heart's like a grapefruit with segments, and each one of these arteries serves a segment of the heart muscle. And if any one of these segments stops getting blood, of course, the segment will cease to function within about 5 seconds, and it'll die within an hour or so if the blood supply isn't restored. So it's very important that it be getting blood all the time. Now, coronary artery disease is the gradual blockage of these vessels by the buildup of cholesterol in the wall of the artery. That process is something that, of course, never happened early in nature when 25,000 years ago, but it happens now because we live long enough and because our diets are rich enough and because some of us have inherited genes that allow us to deposit cholesterol within the walls of the arteries. We'll have more to say about this at another time, but the key thing to understand is the gradual buildup of cholesterol in these blood vessels blocks them. The muscle beyond where the blockage occurs doesn't get enough oxygen, and the patient can either have a heart attack from that or have chest discomfort because the muscle cries out for oxygen, or some other difficulties, including arrhythmias, that can cause serious difficulty for the patient or causes death. So now that you have some idea of how it works, let me just show you that, for instance, a coronary bypass graft would be, imagine that there is a blockage right here between my fingers. If you also imagine that this little pipe that holds my glasses on my nose is a vein from the leg or an artery from the chest wall, I could cut a little hole here and sew one end here, cut a hole in the aorta and sew the other end here, and then blood that couldn't come down the normal pathway from the aorta into the heart, into this artery, could come up a little higher and fill this artery with blood through this bypass pipe that literally goes around the blocked spot. That's what coronary bypass is. And we can make as many of these as the patient needs. This man needs 3 or 4 grafts. So now that we've done that, and that's just the basics, let me just show you around the room a little bit. This patient has, of course, given his permission for us to show you this, and his identity will be completely preserved because he's already prepped and ready for operations, just so that you know his privacy will be protected and he knows exactly what we're doing. He was glad to be able to help us. So let me just show you around the room, and the first thing I want you to look at here is the cardiopulmonary bypass machine. Now, this looks like a jumble of tubing, but actually it's composed of a pump and an oxygenator that actually can oxygenate blood for a period of an hour or two just as well as the lungs can. And we'll use this cardiopulmonary bypass machine to withdraw the patient's blood from his body, oxygenate it, and pump it back into him on the other side of his heart so that his heart won't have to do any work for an hour or two. That will allow us to shut his heart off, that is, give some cold blood to make it stop working, and then we can sew the grafts on with the heart perfectly still so we can do a good job of making perfect suture lines for these delicate grafts. Over here you can see our nursing apparatus where all the instruments for the operation are. One of my physician's assistants is beginning to take vein from the leg, and you can see the patient's draped and ready for operation. And if you look to the left, you'll see our anesthesiologist is taking care of the patient, making sure he breathes properly, and monitoring his cardiac function, which you can see on that echocardiographic device to your left. Almost every cardiac suite in the United States looks just like this one, and this is one of the most commonly performed operations in the United States. So there's the human heart, and you can see it beating away. Doesn't like to be displaced too much when it's working.